Hi, this is Dr. AYYAPPAN Nair. I'm a consultant in shoulder surgery and sports trauma at Manipal Hospitals. I work mostly at Manipal Hospital Whitefield as well as I'm an adjunct faculty at the KMC Manipal, Bangalore. So here, this is a presentation. I had given a lecture at Pune Shoulder Course in 2025, January, where I presented about the virtual implant positioning system called as the VIP system by a company called Arthritis. So this software basically helps us planning your surgery. So especially your shoulder replacement surgery. So shoulder replacement is where the shoulder is pretty worn out and you have shoulder arthritis, and as the surgical option in front of me would be to change the ball socket joint here, and in this particular case I'll be showing how I do a reverse shoulder replacement. So here, this is a excellent software. So what we do is the software has a, a loading interface. It is a loading interface where I put my password in, and it gives me the options of all my patients. So this is a case which has already been planned. They give you initial planning. So this is the interface of planning where you can see that. So this is the ball socket joint. So this is the glenoid. The glenoid is basically your cup or the socket of your ball socket. So here we do put a implant here called as a base plate. You can see the base plate here. And on top of the base plate, you put another covering called as a glenosphere. So you can see this is the base plate covering. And on top of that, this line tells you where exactly your cup or the glenosphere comes and sits. You can also see the options. You can see how this appears on your side view called as a coronal view and also in your axillary views. You can also choose the different sizes of your glenospheres. For example, here in this particular case, now I've just used a 33 size glenosphere, and I can change it to 36 or a 39. I have options where I can lateralize it. That means I can make it move a little more, and also, or otherwise, you can use a centralized system. This is how the first interface appears in the glenoid. Then here again, we go more in depth to the planning in the glenoid side. This is called as a base plate. This is what you can see is a base plate. I have different option here. Base plate. You can see what is the size of the screw I use and what is the depth of the screw I mount to. All that I can plan here at this particular phase. You can see that I can use a standardized. Standardized means it is not too thick. Sometimes I want to make it more thicker, called more lateralized. So then I can increase the size here. So then next step is planning on the screws. So you can see I have to put at least two screws is very much important. Three is very good. Four is the best. But even if I have two screws, that's pretty good enough. So how do I manage the screws? This implant controls here actually tells me how I tilt this base plates in. I can tilt it up, down, move it front, back. You can say I'm putting it front, back. I'm rotating this position to the screws. You can see that I'm rotating the position to screws here. Again, I'm moving it up and down. All these options I can plan out even before I do a surgery. And this is next is the screw trajectory, so I can choose the different screws. You can see this particular screw is pretty long. I can make it short by just pressing over here. It becomes shorter. So I need at least 2 screw lengths here. You can see the 2 threads are just coming out. So this is very much important for your planning. And you can also see that if you see this particular picture where I'm just showing here, you can also see that the central screw is also in perfect position. So, and this is your humerus. Humerus is, this part of the bone is called as the humerus, and where you can see that I have made the necessary cuts. I can see how much cut. See, this is the cut you can see here, 13, and normally we use a 135 degrees tilt here, 135, or you can increase to 155. Normally it's 135 is good, and it has got better advantages. Then I choose what is the thickness of the stem. What goes inside this bone is called as a stem. So I can choose the thickness of the stem. So this is stem thickness. And this gives me what is the actual size, what is the best fit inside the stem. So, and then and lastly, here the upper portion of the stem contains something called as the cup. So I fix a adequate size of cup. So if I'm normally using a 33 size glenosphere, I use a 33 size cup. And this is finally how this appears. You can see. So more in detail. So how do I actually? This is all planning. So how do I actually do it on the shoulder? It's done like this. So I have specialized 5 spoke. You can see that just basically 5 spoke device called as a jig or a 5D jig, which can I can place it on the glenoid or the socket, and that gives me the correct positioning. So this particular device, you actually decide how this is going to be on the actual shoulder. So different options in this Artrix system. So it's not like I do only the Artrix. I'm a frequent user of the Tonier system and the blueprint planning software as well. So I'm also interested in the Acuna Reflect. So I do use multiple systems. So this is basically to tell you about the Arthritic system. So this is the you can see the base plate sizes which we have 24, 28, and again what are the increments in the size, and also what is the size of the screws. So this is central pose and the screws which are available for the glenosphere. So for the base plate, and this is the glenosphere. The size of the glenosphere varies from 33 to 42. I have options of 0 for lateralization, outer position, as well as plus 2.5 inferior. That means there are different options. I can dial it in multiple things to make the shoulder perfect. Yeah, thank you so much. And this is I hope this this talk is not very complicated. The idea is that to give an idea to patients, so how the surgeon or a shoulder surgeon plans out a shoulder replacement surgery, and also to other orthopedic surgeons out there, so how this is done. Thank you. Good luck.